The journey of a cardiac study report
Okay.
within an electronic health record system.
Right.
So to kind of illustrate this whole process, we're going to be following a real-world example.
Okay.
The case of John Doe's cardiac study report.
All right.
So John Doe goes and has a cardiac study done at, let's call it Hospital A. His primary care physician, Dr. Sarah Carter, works at a separate clinic.
Got it.
And she needs to access that report.
Right.
So we're going to walk through how that information gets from Hospital A to Dr. Carter's computer screen at her clinic.
Makes sense. Yeah, the documentation actually lays out a scenario where Hospital A and another hospital, Hospital B,
Okay.
need to exchange patient data frequently.
Right.
Think about patients who might have tests done at one hospital
Oh, yeah, that makes sense.
and have to, receive treatment at another.
Makes sense.
So before we get to that exchange, let's talk about just getting John Doe's information into Hospital A's system in the first place.
Right.
I'm guessing there's a little more to it than just, someone typing a few things.
Right, exactly. It's not just like a paper form.
Exactly.
So what kind of data are we talking about?
So there's quite a bit of data involved. We're
Right.
talking about, basic demographics like John Doe's name, date of birth, address, and of course, a unique patient ID.
Right. Okay, so far so good. That's
Yeah.
pretty standard stuff you would see on any medical form.
Exactly. And then we get into the specifics of the cardiac study itself.
Ah.
Things like, the type of study that was performed, the date it was done,
Right.
the name of the ordering physician, and then importantly, you have a summary of the findings from the study.
Okay, so this is where it starts to get a little bit more
More technical.
technical.
Yeah, and it does get more complex because on top of that textual information, you also have the image files
Right.
that were generated during the study.
Of course.
And these are typically stored in a specialized format called DICOM. So the textual information, things like his demographics, the study details that all get stored in the hospital's electronic health records database, or EHR for short.
Okay, EHR, we've all heard of EHR, but what about those DICOM image files? Do they go in the same place?
Not quite. Those get stored in your archiving and communication system.
Oh, okay.
So it's essentially like a specialized library just for medical images.
Interesting. So we have these two separate but interconnected systems
Right.
working together. Now, let's get back to Dr. Carter over at her clinic. She wants to see John Doe's report. How does she even begin to access Hospital A's system? Does she have to, call them up and have someone email it over to her? Or is it
Definitely not.
a little more high-tech than that?
It is much more high-tech. It's 2025.
Exactly.
This is where the magic of federated authentication comes in.
Okay, federated authentication. I feel like this is where things are going to start to get really interesting.
It definitely is.
Yeah.
So with federated authentication, Dr. Carter can actually use her existing Springfield clinic credentials to log into Hospital A's portal.
I am already impressed by how much is happening just to get her logged in.
Right.
And we haven't even gotten to her actually viewing the report yet.
We're just getting started.
But I'm guessing logging in is only the first hurdle.
Yeah.
How does she actually find John Doe's report within what I'm assuming is a pretty massive system? What does that look like in practice?
So remember those DICOM files we talked about?
Yes.
Those are rendered directly within the portal.
Okay. How does she actually find John Doe in the system? Does she have to manually scroll through a list of, thousands of patients, or
No.
is there a better way?
It's much more efficient than that.
When Dr. Carter wants to find John Doe's report, how does she use this EMPI thing?
Think of an API or application programming interface.
So the portal knows exactly where to find all the pieces of his cardiac study report. It's like a digital detective,
Yeah, well,
piecing together all the clues.
Perfect analogy.
So this is already way more complex than I ever imagined, but it's really cool to see how it all works.
Yeah, it's a fascinating process.
And it all happens in what, milliseconds probably?
Yeah, behind the scenes very quickly.
Yeah, so we've now got the portal. It knows who Dr. Carter's looking for. It knows where to find the report.
Right.
I'm assuming the next step is actually getting that report displayed on her screen.
Okay, so the portal needs to gather two key things.
Okay.
One, the report metadata,
Okay.
which includes, things like the study date accession number.
Okay.
And then two, the actual report and images themselves.
Okay.
And to do this, it has to reach out to a couple of key players. HIE.
Okay.
Think of it as a secure central hub where different healthcare organizations can share patient information.
Right. So that's where those DICOM standards really come in handy.
Absolutely.
Making sure those images get retrieved and displayed properly.
And that's the reason why Dr. Carter can view these images on her computer screen at the clinic, even though they were originally generated and stored at Hospital A.
It's pretty amazing when you think about all these different systems working together.
It truly is seamless.
So let's say Dr. Carter's reviewed the report,
Okay.
and she needs to make a change.
Okay.
Maybe clarify a finding or add some additional context.
Right.
Can she do that? What if John Doe has placed a consent directive on his record that restricts access to certain parts of his information? So she might be blocked from seeing certain things?
That's right. But there are exceptions, of course.
Oh, okay.
Imagine a situation where John Doe is unconscious and rushed to the ER.
Oh, right.
Doctors need immediate access to his full medical history,
Of course.
even if there are consent directives in place.
So that's where the break the glass feature comes in?
Exactly.
I had no idea. There was so much complexity behind something that we think of as simple as, pulling up someone's medical records.
It's easy to take those systems for granted, but when you understand how they work, you really gain a deeper appreciation for the amount of innovation that's happening.
Awesome. We'll be sure to include some links in our show notes as well.
Sounds good.